Today, I want to talk to you about how anxiety is not a mental health issue or a disorder. Hey, it's Dr. Shawn Nabors, West Michigan anxiety specialist and practice owner of the Anxiety Treatment Center of West Michigan. Today, I want to talk to you about how anxiety is not a mental health issue or a disorder. I was scrolling through Facebook and I saw an advertisement for an anxiety product. And in the comment section of the advertisement, someone wrote that anxiety is not a mental health issue. Anxiety is natural, it doesn't mean that you have a mental health condition. And actually, this person was correct. They were spot on with that assessment. What does need to be in place, though, for anxiety to be able to be classified as a mental health disorder? There are different types of anxiety disorders. Anxiety is an umbrella term for a lot of other anxiety disorders. We won't get into that today, but here's what needs to be in place for an anxiety disorder to be classified as a disorder. There needs to be certain criteria met, and particularly one of the criteria is impairment and functioning. What is that? Impairment and functioning, well, I look at that two ways. There's emotional impairment, and then impairment as one is trying to progress their lives. So, emotional impairment, they're becoming dysregulated. They are basically being tortured emotionally by the experience of anxiety, really harming their quality of life. Then there's things like occupational impairment, impairment with your schooling, impairment with your ability to develop friendships, impairment with your ability to take advantage of opportunities in life, and you're really missing out. So it really is stopping you from being able to progress in life in a meaningful way. So that is in a nutshell classified as impairment. So when you have impairment plus anxiety, and we can see that the impairment is mostly caused by the experiences of anxiety, we now have the beginnings of an anxiety disorder. There are lots of people who have high anxiety experiences, but they are very functional and they technically would not qualify for an anxiety disorder. What these people do is they probably function very well because of their ability to cope in various ways with the anxiety, but from time to time they still experience high anxiety because it is a natural thing that we are going to continue to experience. So, again, that person was right. We're going to continue to experience anxiety. It is extremely natural. No matter how high it gets, it is natural. We want to start to look at it with a more concerned eye when impairment starts to become uh, or functioning, excuse me, starts to become impaired in a way where a person is not progressing normally. And that's what creates an anxiety disorder. So, as always, thank you for stopping by and take care.